Have you ever experienced that strange crackling or popping sound in your ear? It's like having a tiny bowl of Rice Krispies popping away right inside your ear, and it can be incredibly frustrating. You might start to wonder, what is causing this? Is it something serious? And most importantly, how do you make it stop? Well, you're in the right place, because in this video, we're diving into everything you need to know about that annoying crackling in your ear. We're going to cover the common causes, the symptoms to look out for, the treatments available, and even some home remedies that can bring you some much-needed relief. Stick around, because by the end of this, you'll know exactly what's going on with your ears and how to finally make that crackling sound disappear for good. So, without any further ado, let's get started. Symptoms of ear crackling. The most obvious sign here is the crackling sound itself, which is a sound that people describe differently, from rice cereal popping to the static of an old radio, or even the sensation of bubbles popping inside the ear. This crackling might become more noticeable when you swallow, yawn, or move your jaw. Beyond the signature crackling, many people experience a feeling of fullness or pressure in their ears, as if they're trying to listen to the world through a thick pillow. Your hearing might seem muffled or underwater, making it difficult to catch all the nuances in conversations. Some individuals report a constant need to pop their ears for relief, similar to the sensation you get during air travel. In some cases, the symptoms worsen when you lie down or first thing in the morning. Physical activities like exercise, bending over, or rapid head movements might trigger or intensify the crackling sensation. Causes of crackling in the ear. Several conditions can lead to the crackling sound you hear in your ears. Number 1. Eustachian tube dysfunction. One of the most common causes of crackling in the ear is Eustachian tube dysfunction. The Eustachian tubes are small passageways that connect your middle ear to the back of your throat. They help regulate pressure and drain any fluid from the middle ear, keeping everything balanced. When these tubes get blocked or don't function properly, you can end up with a crackling or popping sound in your ear. This often happens when there is congestion from a cold, allergies, or sinus infection. The crackling is usually more noticeable when you swallow, yawn, or change altitude, like during a flight or while driving through mountains. To treat Eustachian tube dysfunction, you can try yawning, swallowing, or chewing gum to help equalize the pressure. Over-the-counter decongestants or antihistamines can also be helpful if allergies or congestion are to blame. Nasal saline sprays are also great for reducing inflammation and helping the tubes function properly. Number 2. Earwax accumulation. Earwax is there to protect your ears from dust, debris, and bacteria, but too much of it can cause issues, including that crackling sound. When earwax builds up and becomes impacted, it can block the ear canal, leading to a variety of symptoms like muffled hearing, ringing, and yes, crackling. That's because excessive earwax can create a barrier that traps moisture and creates strange sounds as air tries to navigate through the wax. In this situation, the crackling might be accompanied by a sensation of fullness, mild hearing reduction, or a feeling that something is blocking your ear. If you suspect earwax is the problem, avoid sticking cotton swabs in your ear. This can push the wax deeper and make things worse. Instead, try using mineral oil, baby oil, or specialized ear drops that are designed to soften the wax so it can naturally work its way out. If the wax is really stubborn, a visit to your doctor or an audiologist may be necessary to have it professionally removed. They use specialized tools and techniques to remove earwax without risking damage. For minor accumulations, over-the-counter ear drops designed to soften wax can help facilitate natural removal. Number 3. Temporomandibular joint disorders. The temporomandibular joint, or TMJ, is the joint that connects your jaw to your skull, and issues with this joint can sometimes cause crackling or popping sounds in your ear. TMJ disorders can occur due to teeth grinding, jaw clenching, arthritis, or even an injury to the jaw. When the TMJ is inflamed or misaligned, it can put pressure on the structures around the ear, leading to that annoying crackling sound. You might also notice jaw pain, headaches, or a clicking sensation when you open or close your mouth. Treating TMJ disorders often involves a combination of approaches. Over-the-counter anti-inflammatory medications can help reduce the pain and inflammation. Avoiding hard or chewy foods and practicing relaxation techniques can also help relieve the pressure on your jaw. In some cases, a dentist or specialist might recommend a mouth guard to prevent teeth grinding at night. Number 4. Middle ear infections. Middle ear infections occur when fluid builds up behind the eardrum, creating a perfect breeding ground for bacteria or viruses. This buildup can lead to pressure changes that cause a crackling or popping sound. Ear infections are often accompanied by other symptoms like ear pain, a feeling of fullness, or even a fever. If you're experiencing these symptoms along with the crackling, it's possible you have an infection that needs attention. Treating a middle ear infection typically involves managing the pain and reducing the inflammation. Over-the-counter pain relievers like ibuprofen or acetaminophen can help with the discomfort, while warm compresses can offer some soothing relief. In some cases, if the infection is bacterial, your doctor may prescribe antibiotics. It's important to treat ear infections properly to prevent complications, such as hearing loss or a ruptured eardrum. Once the infection clears up, the crackling sound should gradually disappear as well. Number 5. Muscle spasms in the middle ear. Believe it or not, muscle spasms in the tiny muscles of your middle ear can also cause a crackling or clicking sound. The tensor tympani and stapedius muscles in your middle ear can sometimes spasm involuntarily, leading to a sound that's similar to popping or crackling. This condition is known as middle ear myoclonus. It's not usually painful, but it can be very annoying. Stress, fatigue, or even caffeine can sometimes trigger these muscle spasms. To treat middle ear myoclonus, managing stress levels can be very helpful. Relaxation techniques like deep breathing, meditation, or yoga might reduce the frequency of spasms. In some cases, a doctor might recommend medications that help relax the muscles. If the spasms are persistent and interfere with daily life, surgical options are also available, but they're usually considered a last resort. Home remedies for crackling in the ear. If the crackling sounds you have are not severe and not accompanied by other symptoms, there are some effective home remedies you can try. Number 1. Steam inhalation. Fill a large bowl with steaming hot water. Drape a towel over your head to create a tent and breathe in the warm vapor for 10 to 15 minutes. The moist heat helps open up your nasal passages and eustachian tubes, reducing inflammation and helping to clear any blockages. Adding a few drops of eucalyptus or peppermint oil can enhance the decongesting effects, though plain steam works perfectly well on its own. Number 2. Nasal irrigation. Mix a 1/4 teaspoon of non-iodized salt with a cup of warm distilled water. Lean over a sink, tilt your head sideways, and gently pour the solution into one nostril, allowing it to flow out the other. This process flushes out mucus and irritants that might be contributing to ear problems. Perform this once or twice daily, making sure to use clean, distilled water each time. Number 3. Popping your ears. Controlled ear popping can help equalize pressure and reduce crackling. The Valsalva maneuver is a safe technique that allows you to do just that. Gently pinch your nostrils closed while keeping your mouth shut, then try to exhale slowly through your nose. You'll feel a slight pressure buildup and your ears might pop. This technique helps open up the eustachian tubes and can provide immediate relief from pressure-related crackling. Just be careful not to blow too hard, as excessive force can damage your eardrums. Number 4. Jaw exercises. Chewing sugar-free gum encourages frequent swallowing, which helps activate the muscles that control your eustachian tubes. For jaw exercises, gently open and close your mouth while massaging the jaw joint area in circular motions. Number 5. Over-the-counter solutions. Use decongestant nasal sprays or oral decongestants to reduce inflammation and mucus production. Antihistamines can help if allergies are causing your ear crackling. Always follow package instructions and don't use nasal sprays for more than 3 consecutive days. These simple home remedies can provide much-needed relief and help you manage the symptoms effectively, giving you the comfort you need without always relying on medication. However, if symptoms persist or worsen, always talk to a doctor for proper diagnosis and treatment. Now, we want to hear from you. Have you ever experienced that annoying crackling sound in your ear? What worked best for you to get rid of it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.